We're thrilled to welcome Janis Naeve, partner at Cota Capital, to the show today. Thank you once again for joining us.
Oh, it's my pleasure to be here. Thank you, Drew.
Amazing. Let's kick things off, Janis. Could you just start? Could you share a brief personal intro with us?
Sure. I started my career as a scientist and then migrated through a number of jobs, that opportunities that just presented themselves, and then, eventually ended up in the world of venture capital. But, my leanings and my loves really came from the love of science that I actually came across in high school. So, but I've been very fortunate to be able to build a career that still feeds that and also moves into the business side.
It's amazing, and we're so excited to dive in here. And before we dive deeper here quickly, could you provide a brief intro to Cota Capital for us? Maybe firm intro, a little bit on the core philosophies around it.
Sure. Coda Capital, it's a firm that's been around for about 7 years. The founders, Babak Puchanchi, and then also Bobby Yazdani, came together through different backgrounds, and I think that's what really is kind of the core strength of Coda Capital. So Bobby Yazdani came from Oracle in the early days, and then built his own company and sold it. So he comes from a very strong enterprise software, very operational sort of DNA, I would say. And then Babak Puchanchi came from the hedge fund world of New York, and they started to co-invest together, and then decided, maybe what they should do is create a firm to invest in sort of the net new around software and technologies from bringing their two skill sets together. And I think from the Coda Capital standpoint, that's what's kind of the key differentiator, is it came together organically from two different backgrounds, but they've melded it together in a very a very kind of successful and enjoyable way. So the company focuses on, like I mentioned, they have enterprise software that they invest in. There's some partners that do that. They've established a fintech fund, in which there's two partners that govern that. And then I joined in the health tech space. They do everything from early seed stage to public companies all along the way, and they built out a really amazing platform to enable doing that. So that in a little bit in a nutshell is Coda Capital.
So excited to hear more. And flipping the script back to you, I mean, would love to jump into our first topic here. I mean, really covering your amazing journey to VC. So starting off here, you completed your bachelor's in science in microbiology and PhD in experimental pathology before joining Caltech as a postdoc in neurobiology. Your roles in industry then began serving as the director of business development with Aurora Biosciences and then Accelerator Therapeutics. Starting at the beginning, I mean, really, I'd love to know what brought you to bio, and among the many options when leaving academia, what really drew you to business development to start with?
In the way you read that, it makes it sound like it was a very logical and planned path, which
Of
it was
course.
not. I always like to joke and say that I've taken rather a paramecium approach to my career. Not that I'd advise it to a lot of people, is that I would always kind of migrate to the good stimuli and try and steer away from the bad stimuli. So I tried other things in my life, and they weren't as enjoyable as science. But like I said at the beginning, I've always enjoyed science and the discovery piece of it. And so I was going to I started nursing school early on, right out of high school. And you know what? That didn't pan out, but I got interested in microbiology from one of the classes. Hence, went ahead and did a bachelor's in microbiology. And while I was doing that, I was like, you know what? I'm going to get a job as a lab tech in a hospital. And then during my work getting, my bachelor's, I did a semester turn in the hospital. I was like, no, this is not for me either. And so I thought, well, what do I do now? And I'm like, well, you know what? Maybe I'll just go ahead and get my PhD. My parents were like, oh, sure, just try not to graduate, right? So I was doing my PhD, and what I did know was that I really enjoyed medicine, but I did not want to be a doctor. So I chose experimental pathology at USC, and I was able to take coursework the first 2 years of coursework with the med students, learned a great deal there. And then I did the last 3 years working on my own projects. And then post that, I was like, I enjoyed neuro. So I went to Caltech and did some cloning, because at the time that was, the early days of cloning, and cloned a neurotransmitter transporter. And then after that, figured, maybe, beyond that postdoc, academia wasn't for me. And so then I started working in a lab, and that's really where I really started to evolve, doing bench work. And then little by little, just experiencing other things within a small biotech, moved jobs. And then Aurora Biosciences is really where I made that transition from being a bench scientist to what they called at the time being a carpet walker, where you move to the other side of the business. And I didn't do that logically. An opportunity just presented itself. I was working at Aurora as a scientist, and at the time the CTO called me into his office and he goes, "Have you thought about another line of work?" And I immediately thought I was getting fired. I thought, oh my God, I just started this job and you're doing this. But I was also just very inquisitive and friendly, and reached outside of the lab. And so they saw that as an opportunity to maybe use me in another way. So I moved into project management, and then it just started to evolve again, finding different ways to do things and finding the things I liked. And then moved into what I like to think of as kind of the business of science. Because while I always love the science, I really love even more being around scientists, right? And then, of course, from a business standpoint, who doesn't like to evolve it from that way? So that's really kind of the ontogeny of how I kind of moved through my career. And so then, from doing business development and moving to different companies and going through a couple different acquisitions, and networking wisely and well, I was able to join Amgen when they started their venture fund in 2005. And then, stayed there for 17 years.
Of course, and it's amazing. I mean, thank you again, Janice, for adding color between the lines there. I'm showing the path of you really following the passion, and it's amazing to see how that led you to Amgen. And I'd love to continue down that thread, ask a few more questions there. So, as you mentioned, from your transitions from operating roles at Aurora and Acceptor, you transitioned to become managing director, led up to that. In Amgen Ventures. I mean, for 15 years, you ran the fund and were instrumental in its development as the corporate venture arm it is today. It's amazing and fascinating. I would love to hear more. But just as we start here, could you tell us more about that journey? You mentioned networking, but really what led you to venture in particular?
Again, a bit happenstance. Prior to Amgen, I was at a company called Accelerator Therapeutics, and it was a private company. And when I joined into the business development group, and they had two paths. They could either do a financing, and that was the venture capital piece, or get acquired. So I worked on both processes, and so I learned about venture capital on the other side of the table. Pitching, right? Ultimately, Accelerator Therapeutics was acquired by Exelixis, and note to anybody who's in G&A that as soon as you get acquired and you're in G&A, you better have your resume brushed up, because they don't tend to keep you. But as part of that, I was looking for my next job, and so I sent out an email to all my friends saying, "Hey, looking for the next role." And it just turned out that someone who I had met previous company at Aurora Biosciences, Philip Tagari, I had met him, lost touch with him, but then reconnected with him, and he said, "Well, I've joined Amgen, and they're setting up a corporate venture arm. Why don't you apply?" And so I thought, this is quite interesting. I had learned a little bit about it while I was at Acceptor, and I was like, this is an interesting opportunity, especially for me, right? Because it's not like I went to got an MBA in business or anything. So I thought, well, this could be a good way to kind of feed my interest around science, and then also kind of feed into the piece around the medicine. So I didn't take a real targeted approach. I was extremely fortunate to be given this opportunity, and it was quite fun actually setting up the corporate venture arm at Amgen, because at that time, we certainly weren't the only people doing it, right? There's the old tried and true, the J&J Development Corporation and SR1 through GSK. And so there were a few others, but it was starting to become clear for pharma companies to really access innovation and have that line of sight. Table stakes, set up a corporate VC arm. So that was my introduction to it. I had not done it before. The first 100 million that we raised from the single limited partner just came from the board approval. And at the time, it was, setting up the understanding, the process, helping the scientists and the business understand the value of it, setting up logistics. It was a real creative experience in a way. And I learned so much, and largely from doing it and making mistakes along the way. But there were just a number of VCs that I got in touch with and learned from. And the first 5 years, I would say, I really spent just trying to kind of learn at the knee of a lot of other really great VCs, a lot of them women VCs, like Barbara Dalton and Elaine Jones and Brenda Gavin, they came the early days, and still investing. But then also just a number of really good VCs at the large firms like Ed Mathers at NEA and we had talked earlier about Carol Gallagher at NEA, just a number of them that, I would say my secret sauce, or what I think is the most important in terms about getting good returns, is just co-investing with the right people. But these were just phenomenal people to learn from. So again, kind of a meandering path, really lucky, but that's how I landed in the corporate kind of venture world.
Oh, of course. I mean, it's amazing to see your journey. While it's serendipitous, the passion that led to you, the amazing folks that you had to surround yourself. I mean, it's crazy to see how that turned out, and I mean, just so exciting going forward. As a quick aside as well, I'm so glad you could share a bit more about your passions around Amgen Ventures and what it was like kind of being on the ground floor. But I'd be curious in your early couple years if there were any particular ideas, notes that just really got you excited about corporate VC from a pharmaceutical arm, rather than joining a more traditional VC fund. I know you mentioned you're obviously in those first 5 years, you're networking, you're out there with all those folks. But were there things that just really excited you about being in a pharma VC arm rather than something else that's more traditional, industry facing?
It was like being a kid in a candy shop, right? If you're interested in medicine and you're interested in drug discovery and development, at any given moment, I could reach out to just really wickedly smart people in the different aspects of the whole process, in terms of getting their points of view, their ideas, showing them companies. So it was just, the pharma piece of it was very grounding. One is that certainly, from an Amgen perspective, it was all about the patient. We're there to serve patients. So that kept you really grounded in terms of the science that you were looking at. And then, I'm certainly never the smartest person in the room, but I could sure access somebody who could be the smartest person in the room. So from a corporate VC standpoint, I would say that was just a phenomenal opportunity, and I really enjoyed it. And the other side of it I really enjoyed is, when I started, most of the scientists, they didn't really know about venture capital or that aspect of it. And it was really fun to establish kind of our own little cadre of intrapreneurs, right? Who, once they started hearing about it and looking at these companies, they went from being like, oh, why do we talk to these companies that's, they're just going to steal our ideas, or why do we want to help them, to they're like, no, this is where innovation's happening. We really want to pair up with them. Watching that flip, boy, that was enjoyable as well.
I mean, wow, it's amazing to see that. And the evolution over time within Amgen. I mean, I think that's something I'm infinitely curious about, and I'd love to ask more, right? I mean, so your time as managing director at Amgen, you played a role in more than 70 investments. I mean, with the initial focus, right, when you raised that 100 million, I mean, you started with the fund, honing on early stage drug discovery platforms, and then to clinical stage companies, and then in more recent years, I mean, with a focus on digital health, health IT, and analytics companies. A lot of changes and progressions. I mean, as someone who has seen so many amazing stages and verticals evolve through their career, could you share more about how your own personal mission has really evolved over the course of this time in your career?
Sure. I mean, what, you got to stay relevant, right? You got to change with the times. So, and I was always very in tune to what was going on the outside. It's my job. So, watching the science evolve was, you just got to track with it. So, and then of course you also have to build a business case for investments and showing a demonstration of return. Hence, from falling in love with the science and investing in all these, kind of discovery platforms, to building out a portfolio of not just the early stage, but preclinical, but also clinical. So that kind of broadened my perspective. But then, of course, we've watched the healthcare industry, um, you know, it's going through a lot of changes, really large sea changes, right? This transformation from fee for service to value-based care, right? Because as it stands, the current trajectory is just unsustainable. So from doing that, it pushed me more into other aspects of the organization and the needs and the demands and the challenges and the pressures. And so, it was clear that it wasn't just the molecule. You could develop the best drug, but unless you could find ways to get it to the patient, get it reimbursed, get it out in the real world, those were becoming a very apparent challenges. And at the same time, we were seeing digital, technologies, platforms, software, the iPhone, all that sort of stuff coming to bear, that you're like, okay, it's time to start finding ways to kind of pull those things together. And that, I would say, is really that last 5 or 6 years at Amgen, where, I started out just by, it's cool science, I'm going to support it. Maybe I'd start to get questions around, well, how do you develop it? It was just clear that, unless we understood about not only the approval piece, excuse me, but the reimbursement piece, which plays into government policy, it just totally opened up the spectrum to me. And then realizing that, we need to adopt the tools, digital tools that have transformed other industries to what we're doing today, in certainly in the pharma business, healthcare and development, but in that industry as a whole. And so that just opened up the window to me to the more recent investments I made while I was at Amgen.
Of course. I mean, it's amazing to see how you as an investor, but also Amgen were evolving at the times, right? With value-based care, I mean, implementing reimbursement and changing all of that to build proper businesses as you're looking at investing in that next frontier. I mean, I'm curious about that, continuing down that evolution a little bit. I mean, just again, coming from this amazing experience, building a pharma venture fund. I mean, really, could you share more about this time at Amgen, like really how it shaped your role kind of as a leader in the venture space? I mean, we've seen some of these evolution of business platforms, but were there other things at Amgen that really just were influential to you as an investor?
You know, um, yes, definitely. Well, first of all, like I said, getting involved with across the spectrum of the challenges with what pharma or large, biotechs, what they face in terms of not just discovering and developing it, but actually bringing it to market, and learning from those people. I'm always learning from those people, right? So that really educated me. And then, you know, what I was finding was that there's what we call, it's bioconvergence, right? So we have, we're just scientifically, you're starting to see, mathematics, artificial intelligence, computational biology, meeting up with, basic biology. All of this was coming together, and so I started thinking, okay, look, you know, hopefully the walls are coming down. These boundaries are being blurred, right? So maybe I wanted to say, okay, well, in order to transform healthcare, I needed to get beyond just looking through that single keyhole of, what a pharma would invest in. And like I said, wonderful group of people, very experienced in what they're doing. But I was like, some of these technologies like AI, ML, new enterprise software, it's like it's beyond our, the pharma capability, right? And I was watching pharma trying to, you know, kind of almost redirect themselves or reorganize themselves to embrace the digital transformation. I thought, you know what, it's time for me to step beyond. It's time for me to get, outside, this area, look beyond this tent and get on the other side of it, and have a bigger sandbox, engage with different people. And then from a personal development standpoint, it's like, you know what, it's been a safe, comfortable, supportive environment there within Amgen for 17 years. I needed to challenge myself, right? And so that's what, excuse me, that's what led me to kind of say, okay, look, I'm going to take a different step into the investment world, and that led me outside corporate development.
I mean, of course, and that's a perfect transition. I mean, to now your current role going towards Cota. I mean, in 2022, you joined your current role as partner on the investment team at Cota Capital. As you mentioned earlier, focus on investing in health tech companies, developing emerging technologies, both in biotech and tech, to approach some of healthcare's greatest challenges. I mean, among the potential venture firms, including other pharma-based corporate venture arms, I think you touched on this just before. I mean, what prompted you to join Cota in particular? Was there a burning drive that really led you to Cota?
I this is probably the first time in my career I actually really thought about that next step, to be honest with you, now that I'm talking about it, is that, I knew I wanted to stay in venture capital. I thought that would be where my skill set was. My network was built. I knew I wanted to go into the kind of health tech space because that's where I found the kind of the new exciting, investments to be made. And so then I was like, okay, I need to kind of market myself beyond what I was doing, work with recruiters, things like that. And so I said, look, I want to go to a kind of a tech focused firm that wants to build out the healthcare piece of it so I could bring something to the table. And I wanted to go to a firm where it wasn't huge, right? It was substantial enough that it provided all the support and the platform that I needed, but I wasn't just going to be, one cog in the big wheel. I wanted to kind of challenge myself to be a real contributor. And then also I wanted to kind of have that kind of environment, Amgen was 25,000 people, right? So I wanted to have that different environment. So that was kind of a checkbox. And then it had to be consistent with my kind of my value system, right? And we had to be kind of like-minded in terms of what the North Star is, what the importance is, what the breadth of investments are, right? Because remember, I had started out by doing very early stage things, and I wanted to see a broader perspective. So that was kind of my hunting list. So when I got recruited and looked at different companies, and then actually came and met the team at Cota Capital, it just really hit on all those my wish list, right? Very strong from a technology standpoint, right? Software, tech, very experienced, very operational, right? From Bobby Yazdani. I had spent my time at Amgen investing in companies that never saw revenue, right? These are early stage companies that their value proposition is getting something in the clinic and showing a proof of concept. So I was just at the end of it, I was just learning about companies that ARR and revenue and things like that. And boy, Cota's got that. They've got teams set up for that. They know those businesses. So I was going to learn from that. And then working on the public side, I've got John Kim on the team, who covers the public space, and working with Babak. Very, very interesting, the input and the impact from the street. So I was like, you string all those things together. It's a firm of about 35 people. There's great support groups within our marketing team, the group that does the growth capital. I was like, this just felt like home. So that's what I was fortunate enough to join Cota Capital.
It's amazing to see the transition, and I'm so glad. I mean, the crossover was amazing. It seems like it's a great culture fit. So again, congrats for finding your spot. But I think I touched on one thing in particular that's really interesting to me is, you go from Amgen, right, 25,000 to like 35-person team, right? And so there's a couple changes here and there. But one thing I'd just love to ask you in particular, were there any particular learnings or mindset adjustments transitioning from pharma VC to Cota that were really influential in this change?
Oh God, lots. And I'm still learning them.
I
Um,
figured.
like I said, I think the biggest thing for me was, coming from pharma, I had a certain mindset of where, how value is created, right? And how you measure the value and kind of, a line of sight. It's probably more from an M&A standpoint. I had a certain mindset, right? Um, so you'd approach business in a certain way. So at Cota, it is very operational, very returns driven, very, like I said, very revenue driven, customer acquisition, all these sorts of things. I really had to get my head around that, right? I'd leaned a lot on my scientific background or my scientific, friends, to just really go with the science and follow that trajectory. It's very different. And I really needed to kind of change how I would think about these companies, change how I would even talk and present on these companies. And I still do, right? So it's it's in this weird sense kind of using a different side of my brain sometimes.
Oh yeah, completely. And it's amazing to see how you've been able to follow this passion. I mean, adjust to Coda, and I mean the change of it's amazing, and it's I'm glad that things have settled down. I mean, it's awesome to see you settle in the Coda team fully. While we're on the topic of pharma transitions going into industry, I'd be really curious as well, just from folks that are in pharma right now, either VC or just in industry. Do you have advice for those listening who might be earlier in their careers and just seeking to follow a similar path through pharma?
You know, you mean in terms of like, maybe joining as a corporate VC or joining pharma in general?
I'd be really curious potentially on the pharma VC side, that transition, and then potentially either folks that are in pharma VC and potentially wanting to get into industry
Ah,
in that. So maybe a little bit of both, but
sure.
infinitely curious. Could ask questions all day.
Sure. Yeah, no, and I get a lot of those inquiries, and I'm always, happy to share my thoughts, always caveating it by saying, like I started out, it's like I didn't take a real logical path necessarily, but one of the things I think from getting into venture capital, I get that question a lot, whether it's a scientist moving in one of the two directions or a scientist within a pharma, is that honestly, I was very fortunate. I think if I actually had taken that path, it's very competitive, it's very hard, but it also depends on where you're trying to apply and go. So my advice, just across the board in general is people say, well, should I get the MBA? Should I not get the MBA? What do I need? What skills do I need to develop? That sort of thing. Is of course, whatever you do, you're going to want to enjoy the process, right? So don't get an MBA unless you can enjoy the process. So that's kind of one of the things I always tell people. And then the other thing is, yes, it is competitive out there, but one of the things you're supposed to do, I think, is really lean into your core strengths, right? Be introspective, certainly, everyone is like, well, but I don't have this. It's like, yeah, everybody doesn't have something, but lean into your core strengths and lean into your uniqueness and be able to articulate that as to what you can bring to, I mean, it applies to any job you want, but what is your unique skill set? How do you plan to grow that? And that's what you really need to kind of sell into if you are looking to go from a bench scientist to a BD role to a venture capital role. And then again, be willing to take what might look like a detour, right? Go into the licensing group, or if you're a scientist, a bench scientist is like, make yourself available to help out in the BD group. Do things that increase your exposure, increase your ability to network. So those are kind of more of the soft issues in terms of the kind of advice from my perspective of what you would want to do if you wanted to get into pharma corporate VC, and consequently, if you wanted to move from corporate VC to a more traditional VC role.
Of course, I mean, incredibly well said. And so turning things back to Cota for a focus here, Cota Capital seeks to back the bold, right? To build timeless technology companies. From your own perspective in healthcare, I mean, you're seeking to invest in world-class founders, changing the way we approach some of the greatest healthcare challenges in the 21st century. Could you share more about what backing the bold in healthcare means to Cota in particular?
I certainly coming from the ontogeny of the firm, and certainly with Bobby Asdani's background, and then the other partners as well. It's backing the bold. They identify so much with entrepreneurs and founders, right? And they invest so much time, and they've built up so much internal capability to bring to bear for supporting these entrepreneurs that, frankly, they don't want to waste it on someone who's just going to, tinker around and, it's a new red handle on a lunchbox, right? They want people it's backing the bold, people who are taking the big steps. They call it, the net new, not just kind of something that's new, but the net new. And that's really what's backing the bold is. And they do, Adit Singh, who's one of the partners on the enterprise software side, every single partner is meeting on Monday. He is like a champion for those entrepreneurs. He takes back the bold quite seriously. And these, I want to say he's got Rolodexes of entrepreneurs, but he invests so much time in building relationships, maintaining those relationships, right? Because that's who Cota wants to back, right? These types of really insightful, committed, undaunted, entrepreneurs. So I think that runs through the organization.
Oh, right, of course. I mean, it's amazing to see. I mean, in your own role too, within the Cota Capital team. I mean, you focus on health tech companies that identify key healthcare challenges and develop emerging technologies, both in biotech and tech, to solve those challenges, the big, bold challenges that we address. So within healthcare in particular, I'd be curious, how does the firm develop investment theses? I mean, could you share what they are today within healthcare in your own domain?
Sure. We have some basic healthcare beliefs that really are what help us kind of define where we want to invest, how we want to invest. And so our basic healthcare beliefs are simple. One is that we invest in the U.S. The U.S. has some of the most significant capabilities in innovation, right? People coming from around the world to come to the U.S. to have that experience and being able to innovate, right? In the area of healthcare, we've had some of the most significant opportunities in terms of recent innovation in healthcare, like the first cell therapy patients were dosed here, right? Gene therapy. These are, the U.S. is really key on doing that. Counter to that, though, in spite of all that, we probably have one of the poorest outcomes for healthcare compared to certainly aspects of the rest of the world. So why is that? It's a system that it's $4 trillion, 18% of the GDP. No signs of stopping that trajectory, and yet we're having poorer outcomes, and it's becoming less and less accessible to people. So that is a basic thesis, right? And then you've got the component, the third component, which is what I mentioned I was very excited about, was this whole time, it's, why now? Timely bioconvergence, right? We want to blur the lines in terms of capabilities to solve problems. We don't want it to be that, if you only have a hammer, everything is a nail, right? You should come at it with a solution irrespective of the tools that you have in your immediate vicinity, right? Bring these things together. This is what we should be driving towards right now. It's like taking full advantage of bioconvergence and computational biology and computer systems and analytics. And then that's kind of the fourth component, is that data is being generated constantly around us, right? Manipulation of data, analytics of data, movement of data, right? constant generation of the data, high content data, all this data is being generated. And we've watched other, other industries being changed by being able to harness all that data into insights and changing the business, right? You don't have to look further than retail, right? We need to be able to take that data within the healthcare system and use it to, increase accessibility, bring down cost, and better the outcomes. There's no reason that we can't do that. And to me, that is what is kind of the key underpinning of what we want to be able to do at Cota Capital, why I joined, where I see the convergence of it. I came across a piece of data that 30% of the world's data is healthcare data, right? That's tremendous, and that's growing. So, and it's, kind of sad that we haven't learned how to harness it better to improve the healthcare in the US. So that is our basic core beliefs in terms of, what we're trying to do and invest in healthcare. Now, that said, we got to boil that down to investment theses and the sectors we're going to invest in. And, those are quite obvious and truly exciting. It's certainly life science tools, new ways of diagnostics like liquid biopsies. We're looking at smart connected devices. Again, collecting data, analyzing it, and then also the new modalities and platforms for therapeutics. CRISPR, gene editing, in vivo, ex vivo, cell therapies, new RNA therapeutics. There's so many things from from when I started my career, when you basically had small molecules and antibodies, maybe, right? And now you just got so many other opportunities. So that's one of the sectors that we're looking at. And then how do you bring this together to work within the complex healthcare industry when we have so many different stakeholders, right? So we're looking at how do you apply this information, precision medicine, or the capability of tracking people's longitudinally through their oncology treatment. How do you start pulling all this together to really feed back into the healthcare system, which is now being extremely pressurized through government policy, payers, providers. How do you pull all that together to apply the innovation to bring better, more affordable healthcare to more people? So that is where we're investing in terms of these kind of the thematics, and then the subsectors, and then the multitude of companies that we're looking to invest in.
Completely. And I mean, I couldn't agree more on the sentiment. And I think it's amazing the stages and the key players that you bring into these decisions about how you can best systematize healthcare and bring it forward at every stage. And so that's one thing in particular that I love about Cota. I wanted to ask you more about. I mean, not only are you investing across numerous domains in tech and healthcare, I mean, Cota is also stage agnostic. Given your investments across so many different areas and stages of bioinnovation, how do you both differentiate your fund and also develop deep domain expertise for Cota in particular?
Exactly. I think, Cota is very much a thematics focused fund. So we all need to have our core thematics of ones of what I just described to you. So we all know what our thematic focus is, and we're also specialists. The idea that you can really be a generalist investor, I mean, certainly for us, it's just not, that's not fathomable for us. We want to be thematic specialist investors. And so we each kind of have our places, right? So, but that said, as I mentioned, there are aspects in the group that are doing the, seed startup company formation. And there's, several of us that are investing in the public and later stage, right? Because it is mutually informative. And it creates a culture that is more uniform, right? That you can chart a course a lot better, than if you're just doing early stage, if you know a line of sight to the public, and vice versa to back. I think that is really one of the things that really differentiates Cota, is the ability to, have that breadth of investment, yet build the groups out so you can be still very, very focused thematically, and you bring in the right people, either through, the partners, the advisory groups, and our, even, kind of support systems and, our luminary networks, I like to call it, on the outside, that bring in that specialist point of view.
Yeah, of course. I mean, from the perspective of Cota as well, being such a tech and data-driven background, as a firm itself, really historically, the philosophy of investment in tech has been quite different from traditional biotech. I mean, yet really in recent years, we've seen a convergence of the two models, kind of with the melding of technology and biology to develop many new platforms. I mean, really, where the platform in some cases is the most powerful asset, as we're seeing.
Yes.
And so, really, could you share more about your thoughts on this trend? We'd love to hear more about where you see the frontier of computation having some of the greatest impact in tech bio, digital health, life sciences, and really just healthcare today, what you're seeing.
You gotta really be in tune to these scientific founders, right? And I'm constantly just blown away by what they come up with, right? And I would give you a good example where I think it touches on all these things what you just mentioned. We have uh, a company in the portfolio called Probius, and um, it is a platform that is your kind of basic kind of meat and potatoes, as Bobby Yazdani would say, from the standpoint of there's an instrument and there's a consumable. What they built on top of it, which differentiates it and has me really super excited compared to all these other types of assay systems out there, is it basically digitizes. It's very simplistic in terms of the way it does the analysis, but it basically is able to highly digitize the biology through the application of AI and ML, so that it can actually provide kind of the data readouts across a spectrum of detection. Everything from a small molecule to a paramecium, or proteins, antibodies, and I'm not the person to explain the technology to it, but this is out of Stanford and some amazing founders. They've applied that. And so what's now interesting is now what has come from, you know, the, what we used to call, or would be, the razor blades as a business, right? You sell the instrument and you just get the consumables to be pulled through and stuff like that. Is on top of it, the bioinformatics piece has become so complex and so highly data scientist driven, and data scientists are now being trained just incessantly, right, for these sorts of applications, is that's creating a whole new kind of business model on top of it. So it's not just an instrument, consumables, and you just try and get the pull through to get your numbers up. It's like there's a huge amount of value that's being built there that is highly subscriptive, right? And the cool thing about Probius is that data gets generated. Well, data is immutable. It's there. You can go back and reanalyze it, right? That's a whole different platform that's going on top of our standard models. I think that's where the tech and the biotech are meeting, right? And that's revealing itself to customers like pharma companies who, they know the questions they ask. They know they have the biological samples. They have all that, but they're looking for new ways to have the analysis. But they're also looking outside for those deep analytics around AI and ML, which are just now evolving with people, right? So you're seeing that bioconvergence, on a product level, but even on a higher level between pharma and these entrepreneurs.
No, I appreciate you approaching this from the lens of Probius. I think it's a fantastic perspective from what you're seeing at Cota and this emergence. While we're speaking of companies, I'd love to turn it a bit more about just a different section around company selection itself. I mean, so with that understanding of Cota's investment areas, would love to ask more, just see how you select companies in particular. You and your team have made some incredible investments into companies such as Mission Bio, Probius, as you mentioned, Selfie, Algen, and Purigen Biosystems, among many others. Perhaps using one or more of these companies as examples, How do you separate signal and noise? I mean, really, when evaluating companies when they come in.
The first cutoff is always, the scientific founders and the team, right? I mean, I think that that's even from way back, when I started my venture career and I would first fall in love with the science, and my first investment I lost money on because I didn't really consider the team, right? So we always look at the team. We always look at the people first. And that actually gets rid of some of the noise, right? You find that right mixture of people where they're strong scientists, they've put together teams that they've got experience in this space, so. And then the other piece is like, you know, if they're able to accomplish what they are setting out to do, how important and significant is that, right? That you have a line of sight that the juice is worth the squeeze, as they say. So that's one component. And then the other component is, and it's hard to bring all these things together. The other component is, can you come up with an operational plan and budget that makes sense, with points along the way to gauge progress or need to pivot, right? So it becomes a real operational and practical way of doing it. That is also a way that we get rid of noise, right? If it's high flyers who have nothing but ideas, or people who are just very, pedantic, that gets rid of the noise too, is that you've got to be able to translate the vision into something that's operational and trackable. And then, of course, I already mentioned the technology. So those are the things that we look at, and we try and piece it all together. You don't score, 10 out of 10 on all of them all at once, but you know that you've got something workable to start with.
Yeah, of course. I mean, while we're on the subject as well, I mean, do you have any recommendations for founders reaching out to Coda?
I would say you can always reach us through the website or through LinkedIn. I personally like LinkedIn. I've had a number of people kind of reach out. Do make sure though that it's not really just a cold call, right? Make sure to look at the website, see, you can find the partner who would be most appropriate to, and do reach out on LinkedIn. That's probably the best way to do it, because we're always checking our LinkedIn, our LinkedIn profiles.
Of course, of course. So I thank you for the overview. It's amazing. Hope it's a good call to founders. I'd like to pivot slightly here, and I'd love to dive into Coda's platform of support for founders in particular once they've been selected, right? So Coda is well known for providing not only financial support but also value-added expertise, which can significantly improve clinical and commercial outcomes. As you mentioned in the past, just the support that you and the Coda team provide. Could you tell us more about how Coda specifically engages to provide value-added expertise?
Sure. Sure. Again, this is near and dear to Bobby Yazdani's heart, and also some of the other partners. One thing is they've got an advisory group that is headed up by Sri Rajan, who was formerly head of Bain in India, and there's a group on his team that their job is to help onboard these entrepreneurs. If this is the first time they've built out a company, they give them all the tools and guidance in terms of how do you run your board meetings? How do you put together your board decks? All these things. How do you put together your tracking dashboards? All that sort of stuff. So the advisory group does that. And then also they're bringing experience in, because they're doing this for dozens of companies. They've done this previously in their life. They bring together best practices, and they make sure that all those tools and capabilities are there. And and they match them up with Coda advisors, right, who have expertise in these areas, who will come in and work with the company for a while. So it is a constant and ongoing built-in team that focuses on that. So that's the advisory group. And they constantly are building out new tools and techniques. They'll have like CFO dinners, or they'll have CTO dinners, or all these different things to bring the group together, always creating something in their mind. And then we also have the Cota Capital Knowledge Group, in which they're doing research, constant research across our thematics across the businesses, public, private, and they're able to bring that together to, help the portfolio companies. So in the, so many entrepreneurs, all they know is what they can just Google, what they can access, right? They don't have that kind of a time and ability to like synthesize a lot of information. That all gets synthesized and brought together through the knowledge group that then gets, provided to these portfolio companies. But it is we have quite a number of people that are dedicated to supporting these founders.
Of course. And, as we're speaking on founders and, team support as well, I know something you touched on, even talking about signaling and noise. I mean, a team is an incredible, important moment for you for separating signal and noise. I wanted to hone in on that for a minute. So, I mean, especially given Cota's experience with helping build and scale teams through your portfolio resources you mentioned, I mean, Cota Advisory, Cota University, Cota Research, how do you think about supporting interdisciplinary teams and building long-lasting company cultures at Cota?
That's a hard one, but an important one. I think the interdisciplinary teams, I don't want to make it sound like it's just very organic. It's almost like we don't specifically say, oh, it's got to be an interdisciplinary team. It is, we're here to problem solve, and we will access whoever we need to pull together to solve problems as problems evolve, right? At this stage of a company is a certain problem as opposed to another stage of the company. And so I think just by, it's not like we have a checklist of, oh, let's make sure we're diverse, whatever. It's like, let's make sure that we leave no stone unturned in terms of, whatever problem there is, that we bring the right people together to kind of, to work on it. Right. So, and I think just by the sheer fact of the complexity of the problems that, these people are trying to solve, it, like, by definition, it becomes pretty much cross-disciplinary.
Of course. And maybe adding, not necessarily checking a box or bring teams together in that way, but taking things a step further, a point and rightly of particular focus and importance today is diversity, equity, and inclusion of founders, boards, and just teams altogether when building startups. I mean, given you see and support companies from the earliest to latest stages, right? Just top to bottom. Do you have any thoughts on how we as VCs can provide support to founders seeking to incorporate DE&I into team building across stages up and down?
Yeah, no, it is so important. And I think that we have to make a conscious effort to pause and ask ourselves those questions, right? And make sure that we are listening to any diversity in the room, in terms of the voices. And I know that sounds sort of like a pat answer, but like, an example I give is that, having, been in the business for a long time and been in a lot of boardrooms, when you ultimately sit there and say, oh, we need to add an independent board member, we need to add another board member, it's like you throw out some ideas, and I have to force myself to really think about it, because the first thing I go to is like, what are my other boardrooms, right? And I think of everybody around the table, and vast majority of them are men, right? So you have to press pause and say, no, I'm going to take that extra step. I'm going to take that effort. I'm going to, make sure that when they're looking for new management on the team, that, make sure that the recruiter brings forward at least, 20%, of the diversity in terms of, you have to really stop. And in the busy day, and you're trying to make your company successful, it takes time to do that, but we'll get better at it. We'll get faster at it, right? And I'm really hopeful that when I'm, get asked again, when I'm sitting in the boardroom and I'm thinking through all the different boards that I've been on, that at least, half of the women there's women in those rooms, right? So it's not so hard for me to say, hey, let's stop, let's think about these people. It takes just a real conscious effort, and take advantage of like the tools and the groups out there that are, building these, these tools, databases, training groups that say, no, look, we're putting our shoulder to this. We're putting our movement behind it, right? So we need to make time We need to focus, and it needs to be measured.
Of course. I mean, could not agree more, and hope to strive towards that future as we go along. And glad Cota is, and yourself, Janice, are making a conscious effort towards it and advising other folks towards it. I think it's well said and incredibly wise words. I want to take us into our last section here as a transition. I mean, from the beginning of your career, you've been helping push forward innovative research. I mean, being in pharma, which often serves to select the next frontiers, to industry, I mean, now to venture. We'd love to hear what you've been seeing from founders in terms of the next cycle of emerging technology. I mean, what are you most excited by today?
I mentioned it before. I think that the entrepreneurs that are like, it, there's no boundaries in terms of their solution, right? That the entrepreneurs that really identify a question and develop the tools necessary to address that, as opposed to, this is a cool technology, now what do I apply it to? I'm seeing much more of it where there's a cognizance, there's an awareness, there's a curiosity as to problem solving, and then that really sophistication to saying, how do I approach solving that problem? So that's one thing I'm really excited about. And then also just uh, the societal commitment and impact is also very important to many of these entrepreneurs, right? Certainly the ones that we gravitate toward, right? The ones that are really looking to change things for the better. That's got me excited, but mostly it's the bioconvergence. It's the, we're not going to be held back by the tools we have at hand. We're going to create new tools, and we are going to apply them to what we really think is going to be a benefit to society, not just, we're going to flip this company for a great return. So that's what's got me super excited. And like I said, it's like this building of the data and the analytics in terms of, driving it to an insight that is useful. That to me is super exciting.
Of course, I mean the call to startups is exciting, and hoping in the next decades to come. I mean the tools driven approach. I'm excited to see what we have in store. To turn things around slightly, and anything you're bearish on, anything that you're less focused on with Cota that you'd like to see less, or anything in the industry that's a little much now.
Oh, a little much, right? I probably would say I'd like to see the AI ML applied across the translational medicine piece, not just at the front end for target discovery. So I'd like to see, it really applied more broadly. I'd like to see, applications of like pure tech to help us manage data, get access to data, new ways to increase that, the business models around accessing data, interpreting data, that sort of thing, right? Back in the day, you had servers and all your data sat there. Now it's in the cloud, and it's, so I'd like to see more of that, for sure. And then, I think, when I started my graduate career, it was back in the day when they were making the first monoclonal antibodies, right? And they used to be chimeric molecules, right? They were mouse myeloma cells fused, with the human B cells, so they were chimeric, so they were crazy. So those were early days. And now, when you think, okay, now we're engineering cells, right? Either inside the body or outside the body. We're engineering cells to be therapeutics. I just can't get enough of that. That to me is a really interesting area. Although I have to say that, all of these innovations, and certainly cell therapy, they kind of reach a plateau where there needs to be something that cracks it again in terms of a technology or a way to measure or something like that kicks it up to that next level. I think we're in that S curve there, but cell and gene therapy is, to me, it's the monoclonal antibodies of 30 years ago, right, which gave us all new therapeutics. The same thing here, and there's solutions, there's problems and challenges that are opportunities for these entrepreneurs.
100%. It's incredibly exciting, and it's a good call to future startups of the next exciting frontier and looking forward to the next generation. I mean, continuing down this vein a little bit further, what's coming next for Cota?
I would say it's really getting kind of more intertwined around our different thematics and verticals. And it's always exciting to me. We have our partners meetings on Mondays, and that's when you bring in companies to look at, or you talk about your current portfolio, or excuse me, you talk about your current portfolio, or what's the next thing you're looking at. And when we find areas of just overlap, right, where you're like, that's interesting, you guys are doing that in cybersecurity. I mean, I know somebody in pharma would be interested. Or you're saying, well, someone's saying you can come up with a better way to, like, manage the data from a lab. It's that cross-pollination. I think that's the next step for Cota.
Thanks again for sharing on the future of Cota, Janis. We're super excited to follow along on the sidelines as we can. So before we come to a close, a few rapid fire questions to cap things off. Janis, having given so much advice during your career and been around so many amazing mentors, I mean, we'd really love to learn from your own perspective. What's the best advice that you've ever received, and something that you'd really want to share with the audience?
Sure. Something that's always stuck with me, I got when I was in graduate school. My thesis advisor, I was getting ready to do my my thesis defense, and I was really just nervous. And I got this panel, and he goes, "Look," he goes, "listen to what they have to say. Take what you think is going to help you, and just forget about the rest." And as you go through life and you go through your career, you come across that a lot, and I use that a lot, because that's like, you get evaluated a lot. It's always just like, listen to what they have to say, keep what's going to be helpful, and then just forget about the rest. And that's probably the best advice I've gotten.
No, fantastic, incredibly well said. And so we've spoken at length on your background, Cota. I mean, what's coming next for the fund? I'd be curious to hear. I mean, what's coming next for you? How do you hope to continue supporting and driving bioinnovation, kind of moving forward?
Really learning as much as I can being here at Cota. As I mentioned, it's a different businesses that I'm investing in, different stages of businesses, learning and understanding them better. Having, like I said, not having an MBA, I'm learning a lot on the ground. I'm just going to really try hard to get a lot better about the business aspect of it.
Of course. While we've focused on a lot of the serious on this episode, I like ending with something fun. I mean, how do you spend your free time? What do you do outside of venture that excites you?
Um, I love spending time with family and friends. And then I would say probably most recently I've been doing a lot of I'd say gardening, but it feels more like farming. We got a little piece of property up in Cloverdale, and my daughter's in college, and so we're empty nesters. And so my husband and I spend our weekends up there, and it is literally, vineyards, olive trees, and gardening. And yeah, having grown up in the suburbs, this is all pretty new to me. But that's what I am enjoying doing.
Oh, that sounds incredibly peaceful, and good time to always build up your green thumb while you're getting other things going on. So that's amazing. Any other closing thoughts or shameless plugs you'd like to share?
Oh my gosh, just shameless plugs are always on the women and diversity in terms of CEOs and venture capital. I've had like I said, started off by saying, some of the earliest VCs that helped me were these women VCs, and we've got our own little kind of cadre, that we all lean on each other. And I think that just is so important to this industry, and not just for females, but people of color as well. The diversity of perspective only makes us stronger. So that's a shameless plug.
Oh, a necessary shameless plug indeed, for sure. Thank you for sharing. Thank you once again, Janis, for an absolutely fantastic episode. I mean, we're very grateful for your time. Just thank you again for joining us.
Well, thank you. It's been just a delight to speak to you. You've got a great career doing this, if this is what you're planning to do.
BIOS is excited to share amazing stories going forward, and just appreciate your time. Thanks so much, Janis. Take care.
Thank you, Drew.
Bye-bye.